Summer fun can bring summer injuries, but when do you know if it's serious enough to go see a professional? With us now, our good friend Dr. Jamie Taweel with Grand River Medical. Good morning. I miss talking to you.
Good morning. It's good to see you again. I miss talking to you too. How have you been?
Happy heat wave, a summer day.
Oh my gosh, it is insane out here.
You know what's so unusual is some kind of perspective, because I went to college in the South. So this weather was normal for us, really, and you know how to adjust to it. But I think it's going to be a very hard day for so many people here in our area. So with that, I always get confused. What's the difference between a heat stroke and heat exhaustion?
Well, heat exhaustion is just, significant overheating, fatigue, and heat stroke, I believe, is when you start to have more significant symptoms like passing out and things to that effect. I mean, heat exhaustion will wear you down. Heat stroke is pretty dangerous. They both are dangerous, but you want to make sure that you are maintaining hydration and staying cool as much as possible, listening to your body throughout these times. And I know a lot of times with the summer, alcohol plays a bit of a role, so people aren't paying such close attention. They're also getting a little bit more dehydrated as of, if you're drinking alcohol, you're not drinking water, you're going to get a little bit dehydrated. So always going to recommend, if you're going to do that, always have a glass of water in between drinks to maintain hydration. Also helps with hangovers, things to that effect.
I'm kind of like, were you reading my mind? Because I was totally counting down the hours going, oh, I can get out on my paddleboard today. And, when you go out on the water, you have to have your adult beverage with you.
Of course. I don't think I'm reading your mind. I think I'm reading the mind of all of the Michiganders that enjoy the lakes. I mean, this is just, it is what it is.
Right? As you may remember, I live on the West Bloomfield Trail, and it's been crazy busy right now. And it's like they're weekend warriors out running and biking. So do you see an increase in injuries this time of year?
Absolutely do. I see an increase in injuries in people that have been pretty sedentary throughout the winter or weren't able to really do those outdoor activities they love so much. You have a few hardcore people that will go running in the dead of winter, but for the most part, people have been keeping it inside. And then when the summer hits, they get back out there, and they get back out there with the same vigor that they had the last day of the previous summer. And that unfortunately leads to injuries. People aren't stretching as much. People aren't taking it as easy. You got to work your way back into it. So people tend to, a lot of sprains, a lot of pains, a lot of shoulder injuries from throwing and things like that. So
when you have that, when do you know if you should go see a doctor and get off of, the Google doctor, WebMD?
I think any pain should be taken seriously, of course. My usual comment to people is bad things do one thing only, and that's get worse over time. So if things don't heal right away, or there's a difference between working with a little bit of pain and working through pain. So in other words, discomfort is normal, pain is not. So if something is hurting significantly, and other symptoms as well, pain is one thing, but pain with weakness is a different story. Pain with numbness in certain areas, a totally different story. Pain with limitation to range of motion. If my shoulder hurts, that's one thing, but my shoulder hurts and I can't lift it, that can be a bit of a problem. So, I would take everything seriously. Most physicians have, an online portal or availability to the point where they can reach out to their doctors to see if this is something worth getting looked at. But for the most part, any pain with a second type of symptom might be something worth looking into. And of course, the reason for the pain, I walked a mile and now my leg is bothering me, versus I fell down, a boat dock and now my leg is bothering me. The trauma might be something you'd want to look at a little more.
Yeah, I remember last year starting out running, and I fell, and I thought it was just a sprain, but then it was swollen and black and blue, and I think like a week into it, I finally went and got it x-rayed, and it was a fracture. So.
Yeah. Fractures tend to bruise very heavily. Bones leak a lot of blood. So any type of pain like that with swelling is one thing, but if you get a lot of bruising, that should definitely get looked at. Ankle injuries are huge this year. The ground is still a little soft, so people are rolling their ankles. Make sure you get that looked at. You don't want to keep walking on an injury and making it prolonged, things to that effect. So
I feel like it's harder as we get older, though. I don't know if it's just snap, crackle, pop, like a bowl of Rice Krispie treats because I'm an old person, or it's because I'm not moving enough and, really need to, I don't know, go see someone.
Well, I mean, I think every patient, every person out there should at least see their doctor before the summer, just to A, get a physical, and B, just kind of get a good, clear idea of what their summer activities should be, and get a clear baseline of what they can and can't do. Now, aches and pains that tend to start out in the morning and get a little bit better throughout the day, that can be more of an arthritic type pain, and that's usually what that is. It's called like a gelling phenomenon. You wake up, you're really sore. The more you move, it's like the Tin Man. You kind of start loosening up, and then things get easier. That's pretty common for arthritis and things of that effect. But if you're running and every time I run, the inside of my right knee starts bothering me, well, you might have a meniscal issue, you might have a medial collateral MCL ligament issue, things to that effect. So you want to make sure that you're looking into those recurrent things that happen and are persistent. A lot of repetitive motion injuries we see as well, things that don't necessarily have trauma preceding it, but you're doing the same thing over and over and it's something new. You start to have injuries that kind of form over that repetitive motion, just beating, stress fractures of the foot and so on.
It's funny because as we get older as adults, we don't get physicals. Like, remember back when you were in like junior high and high school, you always had to get that physical to go play your, school sports. I think all adults, we need to bring that back. Let's like make it an issue,
I think we do. Those physicals saved a lot of kids, but at the same time, it's good as an adult to get looked at. Have me take a listen to you. Do you have a huge murmur that needs to get evaluated? Is your heart beating irregularly? You're not feeling it. Some of those things, while benign initially, because you're feeling fine, you don't realize it's happening. But the minute you start to stress yourself, ramp that heart rate up, then things can start to become a problem. So as adults, yeah, everyone should be getting a yearly physical. I think it's definitely necessary. On top of checking all the other boxes, checking for age-appropriate cancer screening, prostate cancer, colon cancer, breast cancer, checking your cholesterol levels, making sure you're not diabetic. I could go on for days.
Hey, so can I ask you, Doctor, are you guys still able to do telehealth?
Yeah. My practice, I like seeing patients. I like having my hands on patients and the interaction, person to person. So I don't do it as often for emergencies or patients that are a little bit more difficult, but there's still a lot of options for telehealth. I know a lot of physicians who have continued telehealth practices simply for, overhead reasons, ease, less waiting times, things like that. But for me, as a primary care physician, I oftentimes, I want to get labs. I want to do a physical exam. So I will do telehealth for simple things, like I feel like I have a urinary infection. Well, okay, that's pretty obvious. We can treat that. And if it doesn't get better, then I'll see you in the office. But, you can't do, I personally believe you can't do a yearly physical through a monitor, but other physicians can and do, a lot of, I don't want to ramble, but, a lot of surgeons they do a lot of follow-ups with patients via telehealth to try, because they just want to know that things worked out well and that they're improving. A lot of that can just be question and answer as opposed to physical exam.
But the thing I like about telehealth is you don't have to be weighed.
Yeah,
you don't have to go in and step on that scale when you get in the doctor's office. You can tell them a chick, right?
Weight loss is my number one question these days. It's all about weight loss. Everybody's, COVID plus winter it was just devastating to everyone, myself included. My Lord. It's been a rough one.
So with that, about another minute with you, Dr. Taweel, can I ask you, COVID, I'm happy that it's not the first question out of my mouth anymore, but still around, right?
Yes, I'm starting to see a lot of cases again. Thankfully, this wave that I'm seeing, if I even want to call it a wave, but the amount of patients that are getting COVID are having much milder cases. It's not as severe, thank the Lord. The hospitals are still getting busy, but they're not as overcrowded as it once was. But COVID is still out there, and COVID is definitely happening. So please be cautious, especially since a lot of people aren't wearing masks anymore. I'm not suggesting that's a bad idea, but at the same time, it is still a possibility. And COVID is still there. People that have had COVID are still dealing with the symptoms of it. Up to a year later at this time that we're still seeing patients that have these symptoms, including, headache, hair loss, fatigue, shortness of breath, phantom chest pains, issues with memory and concentration, brain fog. That's a huge one.
Wow, that's so amazing. Always, as always, it's been great to have you on. I so appreciate your time. Stay cool today. Go out on the lake. Take the day off.
No, it's air conditioning for me. Take care. It's so good to see you.
You too. Take care.